Great. So I have the honor today of speaking to you about what is targeted therapy. So we're going to go through a few different parts about this. So first, I just want to take a step back and understand what are the different tools that we have when we're thinking about treating lung cancer. So we do have some traditional medicines that we think of, or medicine, quote unquote. First being surgery. Can you cut it out? Is it something that we can cut out, and is cutting it out going to help the overall state of the disease? Second is chemotherapy. That's an older anti-cancer medicine. It's a chemical that goes in and interrupts the cells from growing. It targets a lot of different things, can be very effective, but is one of the older anti-cancer medicines that we have. And then radiation, which we're going to hear a little bit more about later in this session, where we use an external beam to target things. Again, asking a similar question that we ask when we're thinking about surgery: can we target something, and does that help the overall disease state, or does it help with a symptom that a patient is experiencing? And then on the other side of this, we have precision medicine, and that's what we're going to focus on today. I'm going to talk about immunotherapy first because that's not the part of targeted therapy I'm going to talk about in general, but it's also a type of targeted therapy. It targets the immune system and stimulates a patient's own immune system to fight the cancer. So it's unlike chemotherapy. It's not trying to kill cells. It's actually just mobilizing the troops that a patient already has and hoping that that will help to provide some anti-cancer therapy. And what we'll spend the most time talking about is targeted therapy, where we're taking advantage of certain aspects of a patient's tumor to slow tumor growth and kill cancer cells. And these come in actually a variety of different types. So they can work in a few different ways. They can stop cancer cells from growing. They can change proteins in a cancer cell so that the cancer cell dies. Like immunotherapy, they can trigger the immune system to actually kill cancer cells, or they could actually just be finding the correct cell, but carrying with them the thing that will kill the cancer cells, like something like a chemical, a chemotherapy, or a radiation. And we use this in conjunction a lot of the time with some of those other therapies that I mentioned. And lung cancer is actually really the poster child for targeted therapy, which is very exciting for us. On the left, I'm showing the rates of death from lung cancer. And you can see it's actually the purple with the arrow next to it. And the survival rates are actually really improving. And part of that is due to being able to find targets in tumors and to be able to target them. So this other graph shows a variety of the different targets that we have and the things that we look for. You guys talked a little bit about molecular testing in the last session, and this is the reason why we look for those targets, is because we do have targeted therapies that can target them. All right, so let me go ahead and here's the progress that we've made. Back in the early 2011, 12, 13, 14, we had a few targeted therapies: crizotinib, erlotinib, afatinib, ceritinib, and we were able to target a few targets. But really, things have exploded in the last 10 years. So we have too many to name, and if I included 2024, we would also see additional agents that were approved in 2024. So this is by far and away the most targeted therapies seen in any cancer. And we're really proud of that. We're really proud of that progress and proud that we're able to offer that to a lot of our patients.